Bony Bankart and Rotator Cuff repair. This is a case of a 53-year-old male with a 3 weeks history of fall. Patient hit his right shoulder where it got dislocated. Went to a hospital where closed reduction was done. Fracture of the glenoid was noted, thus this admission. Load and shift test positive. Checking the range of motion of the right shoulder. Starting with making the 5 o'clock, antero-superior, and posterolateral portals. Next we debride the fracture site to make a good raw surface. Then we separate the labrum from the glenoid surface, to mobilize the fracture to facilitate reduction. Then we make a good raw surface at the glenoid to place the suture anchors. We then pass the suture passer along with the sutures from posterior to anterior. We pass the sutures around the fragment to reduce it. Adding another suture anchor at the antero-inferior part of the glenoid. Then passing the sutures around the fracture fragments. Tying the sutures from posterior to anterior. Changing from TU supine to beach chair position. The coracoacromial ligament has abrasions. Subacromial decompression was done. Suture anchors were placed on the near the articular footprint of the humeral head. Sutures were passed in a 123,321 blended suture technique. Then tying the sutures in a blended suture bridge technique. Then getting one limb of each suture pair to place on the lateral row. Post-op X-ray shows a reduced glenoid fracture. Patient was started on passive assisted, range of motion exercises. Post-op CT scan shows good fracture healing and good reduction. Post-op MRI shows good rotator cuff healing and also the glenoid rim reduction.